Imagine one of your body's most vital systems just shutting down with shocking speed. Well, that's exactly what happens in acute kidney injury, or AKI. Today, we're going to play detective and investigate this sudden and really serious medical crisis to understand how it happens and how it's stopped.
So, just how common is this sudden shutdown? You might be surprised. Get this. Around 15% of all patients admitted to a hospital will develop some form of it. So yeah, this isn't some rare event. It's a huge risk for anyone who's seriously ill in the hospital.
And the stakes? They are incredibly high. For patients who get AKI in the hospital, the mortality rate can climb to a staggering 25 to 30%. That's almost 1 in 3. It's a pretty stark reminder of why catching this early is, quite literally, a matter of life and death.
Which brings us to the central mystery we're cracking today. What actually happens when the body's filters suddenly just fail? We're going to tackle this just like a medical investigation, following all the clues from the first alarm bells right down to the final verdict. Okay, so every investigation has to start by defining the event, right? So what is this sudden kidney crisis? Let's get a really clear definition. So here it is. AKI is a rapid drop in kidney function after what doctors call an insult, which is just medical speak for any major stressor, like a bad infection or severe dehydration. When this happens, the kidneys just can't do their job anymore. Waste products start to build up, fluids go haywire, and the body's entire chemistry is thrown into chaos. It's a full-blown internal crisis. So how do we even know this is happening? How does the alarm get raised? Let's look at the very first clues that investigators, in this case the doctors, use to detect that a kidney injury is happening right now in real time. The first clues are hiding in the lab work, and they are incredibly specific. Doctors are looking for a rise in serum creatinine. That's a waste product from our muscles that healthy kidneys usually filter out, no problem. As you can see here, even a tiny, rapid rise is a major warning. A bigger jump over a week, or a sudden drop in how much urine someone is producing, those are also huge red flags. Any one of these tells a doctor that the filters are failing. All right, so once that alarm goes off, the investigation pivots to finding the culprit. And here's the key. Almost every single case of AKI can be traced back to one of 3 main suspects. Let's line them up. This quote right here, it perfectly captures the #1 cause. I mean, we all get that a lack of blood flow causes a heart attack or a stroke. Well, it turns out that kidneys are no different. They are incredibly blood-hungry organs, and if you choke off their supply, they start to fail. Simple as that. This is what we call a prerenal cause, meaning the problem is happening before the blood even reaches the kidneys. Think of it like a supply chain issue. This could be from serious dehydration, heart failure, a major infection like sepsis, or even really common drugs like NSAIDs, like ibuprofen, or certain blood pressure pills. In these cases, the kidneys themselves might be perfectly healthy, but they're literally being starved of the oxygen and nutrients they need. Okay, suspect number 2 is what we call intrinsic causes. This is where the kidney tissue itself is directly damaged. So if that lack of blood flow we just talked about goes on for too long, the kidney cells literally start to die. That's a condition called acute tubular necrosis. But direct damage can also be triggered by certain toxins, medications, or even the body's own immune system getting confused and attacking the kidney's filters. And finally, our third suspect, postrenal causes. These are problems that happen after the kidney has already done its job. Think of it like a plumbing blockage. A kidney stone, an enlarged prostate, or even a tumor can physically block the urine from getting out. This causes a really dangerous backup of pressure that flows back up and damages the kidneys. Okay, so we've got our 3 main suspects: a supply problem, direct damage, or a blockage. So how do the investigators narrow it down? Let's check out the specific tests they use to find that smoking gun. The diagnostic toolkit is really precise. A urinalysis is always the first step. It's looking for little clues like blood or protein that could point to an intrinsic cause, like an immune attack. After that, a renal ultrasound acts like a surveillance camera to quickly see if there's a postrenal blockage. And if those tests don't give a clear answer, then they bring in the specialist blood tests to hunt down some of the less common culprits. So once the culprit is found, the focus shifts from investigation to damage control. How do medical teams step in to support the kidneys and give them the absolute best chance to recover? The first thing to understand about managing AKI is that there isn't some magic pill to cure it.
The whole strategy is supportive. It's all about creating the perfect conditions for the kidneys to heal themselves. That means carefully balancing fluids to get blood flow just right, aggressively treating whatever caused the problem in the first place, and this part is absolutely crucial, reviewing every single medication the patient is taking. This medication review is one of the most important things you can do. As you can see on this chart, drugs fall into a few different buckets. Some, like paracetamol, are usually fine, but others, in that middle column, like anti-inflammatories, can actually make the kidney injury worse and have to be stopped. Then there's a third group, like the common diabetes drug metformin. The problem there isn't that they hurt the kidneys, but that the damaged kidneys can't clear them out of the body, which leads to a dangerous toxic buildup. To help remember the most common offenders, clinicians often use the acronym DAM. It stands for diuretics, ACE inhibitors, and ARBs, those are blood pressure meds, metformin, and NSAIDs. Stopping these is key. It either reduces the direct harm or prevents that toxic buildup, giving the organs some precious breathing room to start healing. And finally, our investigation looks to the future. What happens after the immediate crisis is over? And with everything we've learned, how can we prevent this from happening in the first place? Well, the good news is that most patients' kidneys do recover, but an episode of AKI is like a major earthquake for that organ. It seriously increases the risk of developing long-term chronic kidney disease later on. It's an injury that can leave a scar. So prevention really starts with knowing the risks. Health guidelines pinpoint exactly who's most vulnerable. This includes older adults, anyone with existing kidney, heart, or liver problems, and people taking what are called nephrotoxic drugs, basically drugs known to be hard on the kidneys. It also includes anyone at risk of hypovolemia, which is just a fancy way of saying low fluid volume in the body, often from a bad infection or dehydration. And that's where our investigation concludes. We've followed the clues, we've identified the culprits, and we've seen the response. But maybe the biggest takeaway is this: knowing the risks is the absolute best form of prevention. Which leaves us with one final question to think about. How can we all do a better job of protecting these vital but incredibly vulnerable organs? Thanks for joining me.